We're always interested in how we can provide the best care for our patients. And we know from published studies in other types of cancer that patients who go to hospitals that treat more patients do better than hospitals that treat fewer patients with that cancer. And so we wanted to look, it's been done with really large cancers, cancers that require larger surgery like pancreas cancer or lung cancer, but we wanted to see what it would be like with the most commonly diagnosed cancer in women, which is breast cancer. And those operations are smaller, people go home the same day, and basically we wanted to see, well, what are high volume hospitals doing in terms of their treatment that makes things better at there compared to low volume hospitals. And we know from breast cancer care that each treatment we give isn't acting alone, but in concert. And so we looked at patterns of treatment in high volume hospitals and low volume hospitals, and we wanted to see which patterns were different in those hospitals. We found that high volume hospitals actually treat aggressive cancer more aggressively, and that was a big difference between high and low volume hospitals. We also found that low volume hospitals were sometimes either doing too much aggressive surgery or they weren't doing enough surgery. And we wanted to see, well, there are other factors that affect whether patients do well or not, whether they have money to get that care, whether they're educated and going to more sophisticated institutions or whatnot, how much money they make. So we took a lot of patient variables, socioeconomic factors, and we looked at that in addition to these patterns of care. And despite controlling for all those different things, we still found that patterns of care were still a strong differentiating factor between high and low volume hospitals.